Tonight on Recruits.
Please help me.
The fallout of a city brawl.
Breathe with me, okay? In.
A tricky diagnosis.
What's wrong with me?
That's what we're trying to work out.
Treat me like a jack.
And an even trickier patient.
The conversation is finished.
It's all right, it's all right.
Every day's another chance to ignite, 'cause I'm addicted. I'm addicted to this universal feeling called life.
It's been 5 weeks since the latest crop of paramedic trainees hit the streets. Jordan has been mentored at 25-year-old John Williams in Sydney City.
Thanks, mate.
John's great, you know. He's able to sort of turn it on and make himself look assured and look like he knows what he's doing, even in times when he might feel like he's a bit uncertain of where he's going with it, and that's really important.
We've come a long way. Let's go further now.
Jordan believes John is ready to experience the responsibility of being primary treating officer.
437, 1C, decontamination in the city.
Tonight is his first test.
It's decontamination. Oh, so sorry. Suck kills, man.
OC, commonly known as capsicum spray, has been used by police to break up a nightclub brawl. The excruciating spray has also affected bystanders.
Please help me. What did they do to me?
Tracy!
What did they do to me?
Don't rub your eyes, okay? I'm just going to wipe your nose.
It's the first time John has treated a patient suffering the effects of the spray.
Face me, Tracy, face me.
Like, can I see?
From what I gather of the situation, there was a bit of an altercation out front of the club with the police and the patient's brother. In the midst of it all, it appears the police have used some OC spray on her brother, and by the looks of it, she's got caught up in it.
Tracy, you up? Tracy, you up?
Try and open your eyes for me, okay? Open your eyes. Come on. Breathe with me, okay? In.
Reassuring the patient is crucial. If the 21-year-old woman doesn't cooperate, John can't help.
It really, quite simply, requires lots of flushing the eyes with water and using a very gentle shampoo to help clean it out. But they've got to open their eyes to allow us to actually properly get that out.
I just want to get out of here.
Can you open your eye for me?
I can't.
It's a difficult task, this one, to properly do it, especially when the patient's agitated.
You're not going to get any worse. And even if you do, you're here with the ambulance, so there's nothing that can go wrong, you know what I mean?
That's right, that's true. I think that's what's kind of calmed me a little bit.
The patient was starting to panic quite a bit, thinking the pain will never go away, so just trying to reassure her and make sure that she knows it will go away eventually, and just to stay calm. Let me just pour some of this over. There we go. Good. You're starting to open your eyes. It's really good.
She's much more cooperative now. John's taken the softly approach. Classic of a probationer to be really gentle and nice, and it's worked well.
Not just drunk talk, but, you know, honestly, thank you so much for not judging me and making me feel like, you know,
you didn't ask
piece of
for
crap.
You're all right.
I know you deal with people like this every night.
You're a decent girl.
As primary paramedic, John has won her trust and effectively treated her.
How are you going?
You know what?
That's
I'm
all right.
embarrassed. I want to deal with them.
All right.
Go home and have a shower.
Night out in the town has just ended up, and she's going to be at the police station now, and she's covered in soap and shampoo and water all over a nice new dress. So, horrible night for her.
Thank you. Like, who's the new one?
Me.
Thank you so
Take
much.
care.
You know what? He's going to make a top ambo.
No, it's lovely.
What I've noticed throughout life, any time that I've helped someone, I've always felt a great deal of satisfaction after it, that I've known I've contributed to aid them in some way when they needed it.
Sorry about that. That was
No, you're all right.
How dirty I looked.
Everyone has their moments.
That's life. Rain, hail, or shine. That's life. We come a long way on the grind. That's life.
For students just starting out at paramedic college, the pressure is on. It's midterm exams.
They keep drilling into us. If we don't pass, we don't have a job. We won't go out. So it's just, there's always the thought of that in the back of your mind, that if you don't pass, you don't have a job. So and nobody wants to fail.
At 21, former Byron Bay lifeguard Blake is the youngest on the course. For Blake, failure is not an option.
I couldn't think of anything worse than having to go home and have everyone know that I was a failure. And everyone go, how's the ambos? And I've got to go, oh, yeah, about that. that's something that, I would dread.
Now, guys, are we all ready? The students are pretty tired and they've been doing a lot of work this week. So even though it's a serious subject, learning how to bandage, we've lightened it up a little bit by having a bit of fun with it this afternoon. Hit it, Mike. We are now going to have the ribbon dance competition. 1, 2, 3, 4. There we go. That's what we want. Okay, come on, some patterns. Let's get it going. That's it. Listen to the music. Go. Right. Well done. For some of that, guys, I think some of you have missed your calling.
Joking aside, Blake discovers bandaging is harder than it looks.
That looks terrible. That's such a bad job. I'm so bad at this.
Blake's got 6 weeks to master bandaging before doing it for real.
I've got a lot riding on this, my future, my whole life plan. So it's pretty important that I prevail.
Out on the road, trainee paramedic Carly Dunn is following her life plan. The 21-year-old has had her mind set on being a paramedic since she was 14.
I remember sitting in a coffee shop and then seeing an ambulance fly by with them. It's like, oh, I'm going to do that. I'm definitely going to do that. Yeah, thanks for doing all the housework.
That's okay.
Such a lovely housewife.
Carly's fiancé, Rob, knew what sort of woman he was signing up with.
I've kind of always been a real challenge seeker and a bit of adrenaline seeker as well. Getting into snowboarding and skydiving is something that I really enjoy doing. Yeah, just like a bit of a challenge, so the paramedic's kind of really working for me.
It's only Carly's 10th shift. She's just been called to a possible assault.
So what does it say? Bleeding from the face, post assault?
Yep.
30-year-old. Oh, there's a police there.
Do you want me to take anything?
I want to try and get it in the car is the first thing I want to do. So we'll walk her there, but we'll just...
Mentor Jane Gilmore knows how confronting the job can be.
Looking after your probationers' emotional needs are really important. We see some horrible things. I mean, I'm 26 years old and I've seen more in my lifetime than most would ever see.
Oh, no. We'll have a talk in the ambulance.
I don't know, Dal.
Where's my husband?
Where were you tonight? You don't know?
I don't know what it is.
Okay.
It's a bit confronting at the start because I wasn't actually sure what had happened. You get to this dark street and there's cops everywhere and then there's this person screaming.
Why have I got this blood on me?
Ready? Step.
1 a.m. in Sydney's Balmain. Jane and trainee paramedic Carly attend a patient police believe may have been assaulted.
That's it, girl. In you come. Sit down. Put your feet up. Put your feet up on the bed.
Why have I got this blood on me?
That's what we're trying to work out.
Oh my God, what happened?
We don't know. We're trying to work that out.
I don't know. Okay. Oh my God, what's happened to my face? What's wrong with me?
Confused and suffering memory loss, it's highly likely the woman has been knocked unconscious.
The first thing I did was look at her head because she had blood in her hair. So obviously she actually has had a pretty big hit to her head to cause some sort of amnesic events. So yeah, it's a bit worrying because you think, well, there's more than just face value that's going on.
Okay, now let's just be.
What's happened to my face?
Don't know.
Where are my teeth?
We can't see anything because you won't let us look. Okay, but just relax for a minute. Okay, I want you to just take a nice deep breath. Does anything hurt?
No, I'm fine.
Okay, now just let me check your neck.
My teeth.
To assess the patient, Carly and Jane need as much information as possible.
So have you got your phone still? Have you got anything? So you're married?
Yes, on my face.
Finally, police have a lead.
Were you with your husband tonight on a ferry?
I think so.
Did you fall off the ferry?
I don't know. Am I wet?
Apparently
I don't know. I don't know
getting off the ferry.
Yeah.
Stumbled over and done all this. Her husband's just here with us now. He was going to get his car.
Oh, we've got you. Okay.
We've got your husband.
God, for that. That was very confusing.
When I first initially saw her, I thought maybe she had been assaulted because she was so confused, erratic, not really knowing what's going on. But once we started to realise her husband was there, it made the story a bit clearer. Where's your husband?
Here he is.
Here he is. Okay.
Oh, what happened?
You fell when we got off the ferry.
What ferry?
You got up the steps and then you fell.
I have no recollection of that.
Because you had a loss of consciousness with
You're
it.
asking what's happened. That's what happened.
While the cause of her injuries is now clear, it's crucial she is examined in hospital.
Why did this happen to me?
she's got repetitive questioning, which always makes us worry about a head injury. Just got to get her up there and get her sorted.
Just weeks into the job, Carly displays all the makings of a good paramedic.
The main thing that I did was just making sure I was calm and just tried to reassure as much as I could, and that's all I really could do.
Few bumps, okay? Carly did really well. It's really challenging, especially at 1 o'clock in the morning when you just don't know. You don't know what could have happened, and thank goodness her husband wasn't too far away that he was able to come down and fill us in on the blanks.
Right, hit us, sweetheart.
After 6 weeks on the road, Chris puts trainee Beck in the driver's seat for the first time.
Lights and sirens. This is what we do.
Lights and sirens driving can be very scary. There's people that just don't know that they need to move out of our way.
Don't crash. That's all right. Jeez, you are such a good driver.
Chris and Beck have been called to a train station. A man has collapsed on the platform.
But it's also come down as chest pain as well. So
Any call-out has the potential for violence.
the first couple of weeks on my job, we had an aggressive patient that did come into physical contact from this aggressive patient, and I was struggling with that. And I said that to Chris when he was back on shift with me, that what had happened and that I was struggling with that on a personal level. Chris has helped me through that because now I don't have that fear anymore. I know how to either diffuse the situation or know when how to handle the patient.
Over 200 paramedics are assaulted in Australia every year. Beck has learned to approach each case with caution.
How you going, champ? Where's your pain?
In my head, my kidney.
So how long have you had that pain for?
All day.
All day?
Yeah, I got attacked on the train at a bus at Newcastle with a knife and a gun. It was the New South Wales police. Came and took a witness statement off.
When was that, this morning?
Jason has already had a bad day.
Did they hurt you anywhere?
I just hit my head on the train seat.
And a history of serious injuries.
Do you have any medical conditions, Jason? What's your medical?
Hepatitis C.
You got hepatitis C?
Yes.
Okay. Any other medical history?
What happened to the skull?
I got hit by a truck.
Oh, fair.
Chris knows he needs to be treated gently.
How are you on your feet, mate?
Not real good, mate.
Yeah. Let's get you up to the car and run you to hospital, eh?
Okay.
Jason has stomach pains and a possible head injury. But his medical history makes the case far more complex.
I'm a little bit confused, Jason. Please don't take this the wrong way. At the train station, you told me your medical history is hepatitis C and that you've had this stomach pain going on for quite a while. Now, in the ambulance, you've told us that you've had past problems with your heart.
I told him. I've been in jail 17 years. Don't treat me like a copper. So I'll jump out the back.
No.
Don't treat me like a jack.
Jason?
No, that's enough.
Jason?
The conversation's finished. The conversation is finished, all right?
Yeah, just give me
The conversation is finished. The conversation's finished. The conversation is finished, all right?
Yeah, just give me
The conversation is finished.
All right.
Trainee Beck has been on the road just 9 weeks. She's had one bad experience with an aggressive patient. Now she's in the midst of her second.
Don't play. Don't play the cop. Don't play the jack with me.
Jason, I won't. It's fine.
Please just don't play the copper with me.
Okay, I wasn't trying to, Jason.
Spending 17 years in prison and getting you to bloody piss me.
All right, Jason, it's fine.
It's all right in there for them to do it, but it's not good all right for you to do it.
Okay. All right.
All right?
Yep.
You're not the Gestapo.
I always go back through their medical history. So once I get to the hospital, I feel 100% confident that I'm going to give the right medical history and everything that the hospital needs to know. And this particular patient, just the way that I worded trying to go back over his medical history made him turn.
You should never ever in this job deliberately wind people up, especially crims and boobies, because I'm telling you, you're dealing with death. You're actually dealing with death. Yeah, I know, mate, but I'm just trying to tell the girl that she's dealing with... You know what some of these lunatics are like? Well, you can imagine what I was like at 140 kilograms of muscle. I mean...
Jason, all I was trying to find out is that I got all of your history. So
yeah, well, I was crook. All right, let's leave it at that.
There was no accusation. I'm just trying to make sure that I've got everything. That's all, Jason.
Okay, sweet. Please, let's leave it at that.
All right.
Well, let's change something. Maybe we crank up a bit of music today, mate?
Yeah, mate, go for it, buddy.
Jason, can I just ask you one thing?
No, sorry, love. No, the conversation's finished, please. I've asked you nicely. Let's just call it quits.
I just want to make sure that aircon's not too cold on you, that's all.
Ah, come on. That's a bit trivia, isn't it?
The patient said he's had an ugly past and he's saying to Beck to just not talk to him. Some people just have no idea how to read the warning signs, and it's a skill and you learn it, and Beck's going to learn it and with guidance, and the important thing is to live and learn from the job that she's just done. You got to listen to the warning signs, you got to change your tone. If he says, don't talk to me like that, just try and change it, or just back off, let it go, change the subject. Leave it alone, that's fine, there's no loss in that. In hindsight, what would you have done differently?
I don't know, Chris.
Do you want to have a drink, Kate, first? Have a drink? Think about it, that's all right. It's all right. Have a rest. We'll have a rest. We'll have a Coke.
I got quite upset after that job because he said the way that I worded it made him feel stupid, and I didn't join this job to make anybody feel anything other than compassion and and relief, and feeling that they've got a friend sitting next to them instead of, just a paramedic or just a, someone from the medical industry. So that sort of struck a raw nerve.
Get your breath back, it's all right. It's all right. Look.
I didn't join the job to make people feel like shit.
Yeah, I know.
Make them feel dumb. Like, I knew the way I started that, I thought, I shouldn't have said that, but I'll just, I'll continue on with it. But so I knew then and there that, I'd started off questioning him wrong.
My question to you is, how long have you been in the job?
9 weeks.
9 weeks? Go easy on yourself. Don't worry about it. Go easy on yourself, mate. All right. My mentoring is done.
In Sydney's Darlinghurst, John and Jordan receive a 000 call.
Sydney 440.
A young man has threatened to commit suicide.
Suicide number, please, on William Street, Darlinghurst.
Every year, paramedics attend well over 100,000 mentally ill patients, a staggering 1 in 4 jobs.
Do we need to bring him here?
It's a little understood part of their work.
We all have a duty of care here to preserve his well-being. He's got a very complex mental health history, and he's threatened to jump off an overpass tonight in front of oncoming traffic.
No, mate.
Jordan and trainee John have been called to treat a 21-year-old man threatening suicide.
It's Jordan. Remember me from very similar circumstances.
So you're wasting your time, right?
John has treated scores of patients with mental health issues since leaving college 5 weeks ago.
I've been shocked to see how much mental health cases are around. I always knew mental health existed, but not to the degree that it truly does here.
The problem is, mate, you can't sit and threaten to jump off an overpass and expect nothing to be done about it. Like, we've all got a duty of care, which you know very well about. There is no other option other than going to hospital again this evening.
Fine, mate, let it go on for fine.
The young man has been previously diagnosed as suffering borderline personality disorder.
They're very difficult to manage, and they often have behaviours like where they crave attention and affection, and that will often manifest in any way they can. It doesn't have to be positive attention seeking, it can be very negative too, like harming themselves or frequently presenting at hospital. Mate, you're sitting on an overpass. Sorry? Trying to jump in front of cars. Can you foresee the impact if you landed in front of someone else's car? Because if you killed one of my family members from landing on it, I'd be pretty off. So let's just go up to hospital.
I think the most challenging part of mental health case, especially in a case like this one, is just trying to communicate with them. They always seem to kind of put up a big wall and trying to break through that, just try and get the best help for them. But they might not always realise that you're just trying to do the best thing for them.
So I can't do this, man. I can't go back there.
Listen, you have to. You have to.
I can't.
Well, you have to. Because you can't keep sitting on overpasses threatening to jump off. That's it.
What the f***?
We've had to restrain him with the assistance of the police, and he's going to need to go back up to hospital under a Section 20, which means that he's forced to go against his will under the Mental Health Act.
No.
Give me that leg. Give me the leg.
Give me the leg.
Mate, I'm not having you jump out of the back of the ambulance and cause me to crash.
Diffusing tension is a crucial skill. Jordan has a deft touch.
Don't kick me because I've got a model's face. The psych specialist is going to come out and speak to him and see what more he would like and go from there. I believe that his mother was murdered at quite a young age and he's been subjected to quite a lot of sexual and physical abuse as a child, and they would all be contributing factors to the mental illness he suffers today.
Providing frontline care for the mentally ill is as much a paramedic's job as treating trauma.
Pretty sad situation to see a guy so young going through such a hard time. I mean, wanting to take his own life at 20 years old, you know, he's got his whole life ahead of him, so really need to get him inside and get a doctor to see him and try and sort some of his issues out for him.
Finally, the young man will receive the care he urgently needs. Next time on Recruits, John attends a drug overdose in the inner city.
What's happened?
You had heart trouble.
Carly faces a life and death situation.
Pretty intense at the moment.
Deep breaths, in and out.
And Jenna has her first baby.
At first I was like, I don't want to deliver a baby because I was really scared about it.
And for more Recruits action, log on to the website